Hey, we do have a quorum, so we can go ahead and operate if that's okay with you, Dale.
Okay.
Because Matt's got to have this in
Yeah,
tomorrow.
tomorrow. I got a whole day.
Yeah. Why are we rushing?
Yeah. I thought I had it all taken care of last time. Apologize.
Basically, you just give, if I understood the emails correctly, you mistakenly give us the
Last
current years.
Yeah, they're basically, they look exactly the same other than this year's changes the pay rate based on the pay schedule that the council set. The old one had an old pay scale on it.
Okay.
Which, with my initial email, I wasn't aware that that pay scale was a set pay scale, so.
Is there, Jane shared some information with me on this, Matt. Did you originally have a pay scale for a LPN instead of an RN? And now you're actually going to hire an RN instead of...
Katie has been working as an RN. From what I found out, there was never a 144 turned in for her. I do have a copy of it, but apparently it was never turned in up here, so that was before me having any responsibility for it. So now, so I did bring a 144 for Katie, who has been working for us as an RN. So that's why the pay scale was changed when she became an employee. So it was like with the 2088, it was at 1479 or something like that.
And
So then the new rate is
2192.
2192, is that correct? Is the RN.
Right.
And this position is the public health nurse?
No, this is she is a part-time public health nurse. So she is a public health nurse, but just part-time, not the full-time.
Okay, and her responsibilities are
She
primary
works,
responsibilities.
she works hand in hand with Amy, the nurse, and they're doing vaccines. She's doing a lot of the building. They're learning everything basically together. So
Okay.
she's doing all the same stuff that our nurse is, but our nurse is not able to get everything done. So she's doing the vaccines at this time. When she was hired in, was to do communicable disease, and we haven't got to that yet, but that's on her list of stuff that she does as her position. We're required by the state to track communicable diseases and contact people and stuff like that. And this is not the this is other communicable diseases. So.
Okay. And then the clerical assistant is our clerk down there.
No, that is Stephanie Hoffman. So these are both part-time positions that are paid through this grant specifically. They're not paid out of anything but the grant. So they're two part-time people that are have been working down there for the past several years under this grant.
Okay.
So Stephanie was the one that she covered the office for us when we were without Stephanie and Katie both were part-time. They covered the office when we were with the had two positions open. So
Okay.
they have been there, both been there for several years. Or no, Stephanie's been there for several years. Katie's been there for about a year, if I'm correct. So 9 months, something like that.
Okay. And their wages are fully covered by this grant.
Yes.
But this is not the tobacco money.
It is. But there's two grants here.
And I apologize.
that's
I just
all right.
don't understand
Okay.
totally what the
yeah.
grants are supposed to be
There
doing.
are two grants here. If you look at it, there's the Indiana Local Health Department Trust,
Okay.
which is the tobacco. That's the yellow one. That's the $37,000.
Okay.
Then the Local Health Maintenance Fund is another grant that's $33,000. And the way it's broken down on their sheet, the yellow items are the local health department trust, and the green are the local health maintenance.
Okay.
So the green stuff is paying the salaries on the right-hand side,
Mhm.
and the yellow is paying just some office expenses and stuff like that.
Okay.
So that's how it is confusing, because like I said, it's two different grants on one application.
And these two positions are solely paid by this
Yes,
grant only?
Yes.
Okay.
So that's,
There's no other funds going into their salaries?
no.
Okay.
And like I said, this is,
I apologize, Dan,
For what?
for butting in.
No, you're not butting in.
I-
I'm learning with you. So, if I'm reading this right, is the sum total for the Tobacco Settlement Trust $9,138.05?
no, it's the 33,000. Correct?
No, you said yellow is the tobacco, didn't you?
Yes, yellow, 17,000.
17,788.
Okay.
The numbers at the top.
Yeah.
17,788, and then the
No,
local health.
the yellow is the trust, the tobacco settlement is the old term for it,
Yeah.
and the green is the local health maintenance. Yes, which is the 33.
So with the tobacco, or the trust, let's call it what they call it now, but the trust fund, are we required to spend that on anti-tobacco?
Not,
Or is there specifics that
Not
we need to be
it-
spending that on?
I think it's what it's been used for here is what has been set up for every year is just the supplies and stuff like that. But I still have some checking to do, and all that money also has rolled over every year when it's not been spent. So we have $100,000 sitting down there in this tobacco trust, and I've sent away to the state to ask what we need to do to.
Be able to utilize that? Okay.
Because it's sitting there, the money's there, but we don't have.
So is that
line
here
item for
in
it.
our local funds, Jane, or is that
Yes.
still at the state?
No, we have it.
We
In
have
our-
it, okay.
Yeah, so that they haven't been using it, or it all rolls over, it stays there, so, I have to figure out how to,
Reappropriate it,
right,
and what we can appropriate it for?
right, yes.
Okay,
So I know it's been used for other stuff before, because of like, I bought my truck out of it,
okay.
so it doesn't have to be just tobacco stuff, so, because I know that when I bought I bought two trucks out of it, or bought the Dodge 15 years ago, and then I traded in for another one. I think it came out of tobacco settlement. So I don't think they're real picky about what it goes to.
They just wanted money out of
I'm just
tobacco
trying-
companies.
yeah. I'm not having any luck with the grant administrator that is in charge of this. And I've even called the other counties and said, "Who are you talking to at the state?" And they gave me the same person that I've called and emailed, and that's not responded. So I don't know. Maybe they're out of the office or something.
Well, maybe the COVID thing.
Yeah. But yeah, so that's where we sit here. Katie and Stephanie are both part-time, paid strictly out of the local health maintenance. They have been really essential to our office staff because there's a lot of stuff that they do. We wouldn't be able to get by without the part-time help. But then, like I said, it's trying to figure out how. It's been confusing to me to figure out how to use this money because there's.
Well, I'm sure
There's
I'm
money-
sure it's been an uphill climb for you.
Money sitting there that, well, we were going through papers and this has, every year it has a total that you want to roll over and you just tell them how much you're rolling over, and every year we've told them, and then there's an annual report too to the state every year that says how much is in that fund, and I found the annual report last year that said $107,000 sitting in there. The state's fully aware of it, so it's not like they don't know it, but like I said, I just haven't figured out how to allocate it yet, so.
Yeah,
And then,
okay.
where it needs to go and what we need to do with it is another question, so.
But you do have an active anti-tobacco
Yes.
campaign, don't you?
Yes, and it's been not doing much.
Mothballed, so
Yeah.
to speak.
So we already have like 4 new enrollees since we've got a new nurse, so we are getting that going. Our number one priority right now has been the billing. We were left with no info on billing. The only person that ever done billing was Megan. She started the program and everything, so when she left, she wouldn't share what she was doing, so we've started from scratch. And Amy and Katie are pretty much about where we need to be on the billing program.
Okay.
So once we get the billing program, we want to get rolling. We already are rolling on vaccinations. We're doing by appointment, and everybody comes in and walks in and is getting a shot. So we're getting going on that, and we should have some income coming in. We want to set up. We want to get set up something with the county and the city for the county and city shots. So we want to get that set up here soon. And then we're doing all the stuff for the school. So we are getting busy and rolling on that kind of stuff. But then,
And I think you said you were going to coordinate something with the
Yeah.
senior center.
senior center, and we have a whole list of people we want to call to coordinate. And like I said, we're just getting our feet on the ground is the big thing now. So, and we haven't even we haven't done anything with them for the last few years. So
You're going to be on a dead run for
It's
a few
busy.
months.
Yeah, and then I had I was on the call with Dr. Box this morning on the vaccine. But they actually expect us to have some vaccine rolled out in November for the coronavirus. So,
Okay.
so that is coming. So that's
Most likely that'll be handled through the health departments as well, won't it?
they're gearing up to be able to give it to everybody though. I mean, we'll be the main source, but they are direct shipping to nursing homes. They are registering pharmacies and stuff like that to give it
Okay.
as well. So. I don't know that there'll be a big rush, but at least it'll be available, so there can hopefully be some
I
normalcy.
think there'll be some
Yeah,
pullback from general public too.
yeah. The one negative that I see right now is that it is not effective, it's not as effective on seniors over 65. So what they're recommending at this time is everybody around them get vaccinated.
To try and
So-
not take it to
So,
them.
Yeah,
Yeah.
yeah, so they're trying to vaccinate. There is some effectiveness, but they're not sure yet, but they're saying it's not as effective on 65 and over, so. But it's all, there's 3 different vaccines that they're putting out. They all 3 have to be stored at a different temperature. They're all 2-stage shots, so you have to get one shot and then another shot 28 days
A
later.
booster.
Yeah.
Similar to HIV or hepatitis.
Yeah, yeah, so, but it is nice to see that there's something there, so.
Okay.
But yeah, like I said, this grant was the same one we've been doing for several years, so.
So
it's
basically
even
the
last-
bottom line numbers are the same as the other day.
Yeah, everything's the same. The only thing that really changes is there's a few changes in payroll, and I moved some stuff from maintenance to equipment, which there was a contract for a Helmer freezer, and then that's been getting paid out of a different fund, so I didn't need it paid for out of 2 different grants, so.
Okay.
But we did up the
The Social Security Medicare?
yeah, Social Security Medicare.
Fringe.
Fringe, that's what we're
Yeah.
asking for, to make sure it covered. But even, we haven't been, this year, I think there's like $14,000 carryover because there were several months where no one was working at the position, either position, so we got a lot of carryover again this year, so I'm gonna try to,
Well, how easy is it, and maybe these two don't want more hours, but how easy is it just to add more hours to them?
to try to get Katie to work more hours.
So it's a situation where she doesn't want to work.
She's in school right now.
Okay.
So she's unable to work more than the 2 days. I would, in my mind, I'd hopefully be able to find somebody else to also help. So,
Well, that's what I
yeah,
wondered if,
yeah.
as
So,
long as we keep them
yeah,
at a part-time
Yeah.
basis, then,
yeah, and because I would like to,
especially if you're doing
Yeah.
some evening clinics or
yeah, and
whatever.
we're working on getting our testing site up and going too. So, so we did get that $100,000 there, and I applied for that first $50,000 of it. So we should be getting a check here anytime soon. So that money, in my mind, is, and I got to get everything worked out. In my mind, that money is going to pay the salary of the person to do the testing, and there's going to be another $50,000 there available to come back and just I can put my whole staff on that other $50,000 and actually reimburse the county for our salary because we are also working the site. So hopefully we'll be able to overcome some shortfalls in our budget by having the COVID grant actually paid.
Reimbursed for salaries
Our salaries.
that are already being paid out of the health
Right.
fund.
Yeah. But this money, like I said, I haven't allocated it for anything in particular yet. There's, as much as it's strange when everybody's showing them money, we're like, they just threw the IT grant at us too, so we're like, no shortage of equipment, so we've got the $80-some thousand IT grant that's going to replace all our equipment and then hopefully upgrade our software so we can add a billing program down there where all this insurance billing will go through one program and stuff like that. So with we're not short on funds as far as equipment, so but I'm going to try to transfer that over to where it repays the county for some salaries.
Okay.
Other than I would hopefully like to get somebody else in there part-time to also assist. The COVID testing, we did write that up as a contract employee, and I've got a contract for it and everything. I'll present it at the next meeting for the person to do the COVID testing. So.
Great.
But yeah, I just need approval on this to send it
To
in.
submit it.
Submit it, so.
Okay, you ready for a motion?
If you're ready to present it,
Okay, I'll move to approve the revised budget schedule for the Health Department's Indiana Local Health Department Trust Account grant and the Local Health Maintenance Fund grant.
I'll second that motion. Motion made and seconded to approve the application process for these two grants as it was revised and presented to us today. Any other questions for Matt? Any other comments? All in
No.
favor?
Aye.
2 ayes. Mark not being present.
Got it.
On the last, when they do the carryover report for these funds, that 107,000, there is a listing in here what we plan on using the funds for. And then the previous one, they just said they would like to improve the tobacco cessation program and do a vital records management program, and would like to use a portion for a new receipt program and 5,000 for the Everbridge system. So apparently there was some money going to Everbridge, and we intend to use any remaining funds to explore additional programs that enhance our department and provide services to Fayette County residents. So that's how it was. That's kind of an open.
That's a pretty broad.
Yeah. The report was approved and accepted. So
I mean, if that's accepted, it sounds like, to me, if it takes another part-time nurse to help provide vaccination programs, then maybe you can.
And the vaccination is really where I'm pushing because that's where we're going to get income coming from. So
That's your revenue stream.
Yeah. So every vaccine we're getting a $25. We're getting a $25. We're getting repaid for the vaccine. We're getting $25 for the administration, and then there's also a fee for. No, there's an administration fee, and then there's the fee for giving the shot. So
Yeah.
So it turns out to be a pretty good amount of money. So for ones that are insured.
Now, I think I remember when I first took over as commissioner, maybe it was this time, Paula come up, and I think she requested the fees to be adjusted for the
fee schedule.
vaccine.
Last one I found was in 2016. The
Okay.
fee schedule. Yeah.
And I wonder, is that something that needs to be addressed and brought up to date for next year? I mean, for next year's budget?
We're looking at it now. We haven't decided if we need to change it yet, but we went and got a copy of it to make sure we were billing correctly. And basically, mostly it states that we bill based on Medicaid rates. So it is correct to say that we are billing based on Medicaid. The only thing on the fee schedule that I saw was different was the what we billed for people that didn't have insurance.
Okay.
So we're billing the
So
cost.
it's got the built-in
Yeah.
acceleration,
Right.
so to speak.
So we're billing the Medicaid rate, and then for the hard, it's called hard something, if you didn't have insurance. We're billing them the cost of the vaccine plus 10%.
Okay.
So it was just, so that way that
It covers,
it covers our.
yeah, without having to modify the ordinance.
So anybody that doesn't have insurance, we're not billing anything more than our cost.
Yeah.
Than everybody else. The insurance, we're billing what Medicaid allows us. So
Okay.
it's pretty well set to where it needs to be.
Yeah.
So it does change, yeah.
I know years ago we did that with EMS. When I was on EMS, the city finally changed their ordinance to
Mhm.
that it was Medicare accepted, so
Yeah.
that wherever Medicare went, Medicare and Medicaid went,
Right.
our ambulance fees could go.
Yeah.
So you didn't have to address it on a yearly
Right.
basis.
Right. So, but on a different note, we've had no positive cases for 2 days. So that's positive.
Yeah.
Only had 3 like over the week since 3 or 4 since the 25th. So
Okay.
What is our local number on positive cases now?
it was last week. It was 367 or something like that. So, but that was last week. So I'd have to double check the current number. But,
Less than 400.
oh yeah, yeah.
We
I
don't.
mean that's a cumulative number. That's,
Yeah.
That's not.
In the last 30
Yeah,
days,
yeah.
or
So I know last week when I was on the call, Reed only had 13 people in isolation in the whole hospital. So that's how many counties? 13 people in isolation. So it seems to be some indication that this, and what, like I said, what I talked about before was that it seems to be some kind of, we're building some kind of immunity already. So people have had some minor exposure and built some immunity. So it seems to be what the general consensus is.
and I still argue that we need to be looking at the hospitalization numbers
Yeah,
and not necessarily just the positive
right,
numbers.
right. I agree. So
Uh,
I haven't responded yet. Dr. Huth from Reed wants me to. They do a weekly television show, and they want me to be on Friday. I don't know yet, so I don't know that it's a call-in show, and but my general response is going to be, and I don't know if they want to hear it, is just use common sense. So it's a common sense issue at this point. Wash your hands, distance, take precautions. So it's not a you can't do anything at approach that I have anymore. It's a use some common sense approach. So I don't know. That's not
I fully
necessarily.
agree with
Yeah.
your thoughts there.
Yeah. So I might go on and tell them that, but I don't know that they want to hear that. But.
Maybe your one and only interview.
Yeah. So, but I don't know. The only reason they called me is because Dr. White said no. So
I can't imagine him saying no.
yeah. So I don't know. I'm not. It's kind of daunting to be just on it's a Zoom call on top of that. So,
Wow.
but,
I'm not a big fan of our electronic
yeah.
videoing.
But no, I think I'm really happy with the direction we're going down there. The staff, I'm really happy with the staff. Everybody's
Good.
got the same goals. The only problem so far has been the learning curve for all of us. So part of that's me, and part of that's too many things, too many new things. So, but I think we're on top of everything. So Jane's been also very helpful. So
Real quick, just to make it official, he presented the 144, but we wanted me to make a motion to accept that, so we've got it in our records.
This goes along with the grant, right?
Yes,
Yeah.
she's the nurse for the grant.
I don't.
Okay, does anyone's name go on it, or just,
I think Katie was. Did I not have Katie's on that?
Yeah,
oh,
it's-
here it
okay.
is,
Yeah,
it's down
yeah,
here, yeah,
she's
Katie
fine.
Rowland.
Katie Rowland.
Okay, I'll move to approve the 144 for Katie Rowland, registered nurse for the health department.
Matt, do you have maximum hours or per pay
I do not.
on that, or?
I do not, because it's just handled the same way as the other one. It was just handled through, if there's money available in the grant,
Well, it would
there was
be
money to pay her, so.
Up to that amount.
Up to
Yeah.
this amount, okay.
Yeah.
Okay, up to the 18.5 is what. I'll second that motion to approve the 144 for Katie Rowland, an RN nurse at a part-time wage of $21.92. Is there any questions or comments? All in favor?
Aye.
2 ayes with Mark not present.
Thank you. So I think that's it. I'll be back for the next regularly scheduled meeting to provide more updates and info.
Okay, great.
And
Thanks,
I-
Matt.
So I apologize for making you come in today, but I appreciate you coming in so I can get this sent off. So.
Yeah,
Thank you.
thank you.
Thank you.
The only other thing, Dale, that we advertised for, we had a question of a burn ban, potential burn ban, and I'm not gonna find it there. Took it upon myself last night. I contacted Chad Ripperger, who is chief of the Bentonville Fire Department, asked him to contact the other 2 chiefs if he would and mull over the idea of a burn ban, and he returned last night with that at this time the 3 of them didn't feel that it was necessary.
I would agree with them.
Well, I would too.
Yeah.
His major concern was if we put on a burn ban, he said every year it seems like in the past we've put on burn bans and they run the volunteer fire departments to death because every little fire that's seen gets called in.
They're learning.
And he said it just runs them to death. And that they haven't had one fire. It says that all 3 of us do not see the need in a burn ban at this time. There has not been one single fire in the county due to reckless burning to this point.
Well, the grass out there is green. You couldn't get it on fire with a flamethrower. The beans are disappearing fast, and the only real threat to the cornfields, as I see it, would be the equipment that's in there.
The machine itself.
Yeah.
If something caught on fire, some of the equipment caught on fire.
Yeah.
So, all 3 of them didn't feel that it was necessary at this time. He said, if it doesn't rain anymore, he said we can look at it next week, next Tuesday, when we have our regular meeting. And
Well, we just don't have the climatic conditions here that they have in Northern California and Oregon. You know, it's different here.
so
I'm not concerned about it.
I just wanted to make sure that I brought that knowledge to that, or what I received from Chad last night.
Yeah.
So I've always made it a point to listen to those 3 positions, whoever might be in those positions, and try to honor their wishes
Yeah.
on it.
And I would think that probably every time a burn ban has been put in place, there's always going to be a few people that would go out and start a fire that normally would.
Yeah, yeah.
That's Dale. You're not gonna tell me I can't start a fire.
That's,
I'm gonna burn one now just to show you.
I was thinking that, but I wasn't going to say it.
yeah, blame it all on me.
So that's where I'm at on the burn ban. I think we ought to hold off.
For sure. I don't see any need for it.
With that, I don't think we have anything else that was on the agenda.
Nothing else on the agenda?
That was it.
Okay, I'll move to adjourn.
I'll second that motion. The motion made and seconded that we adjourn the special session. All in favor?
Aye.
2 ayes. Meeting adjourned.